All right, so we're going to talk about some antihypertensive medications in this video. The first medication that we're going to talk about are going to belong to the oral type of medication. So, for example, atenolol and metoprolol. So, they're considered beta 1 blockers, and African American hypertensive patients do not respond well to beta blockers alone for the control of hypertension. The adverse effects of this drug can include bradycardia, hypotension, stroke, hyperglycemia, and if it's a beta blocker, it should not be abruptly discontinued because the rebound hypertension, angina, dysrhythmias, and myocardial infarction can result. When it comes to cardioselective beta blockers, there are going to be four B's that you have to remember. The first one is going to be bradycardia. Again, you withhold it if the heart rate or the apical pulse of the person is less than 60 beats per minute or the systolic pressure is below 100. Also, if there's breathing problems, example, the patient has asthma or COPD. The third B is if it's the heart failure is getting worse or getting bad. So, example, symptoms would be increased edema, increase in weight gain. And the fourth B is going to be blood sugar masking. So it basically hides the side effects or symptoms of hypoglycemia by removing the classic symptoms. Another type of antihypertensive is what you call the ACE inhibitors or angiotensin converting enzyme, which is produced by the lungs. So the drug in focus for this type of medication is lisinopril. Lisinopril is, again, its function is to block angiotensin 2, which prevents aldosterone production. It also causes decrease in and increase in water output, so it basically the patient will urinate more, and because of that, it retains potassium. It has little to do with the heart rate. When it comes to race, African Americans and older adults do not respond to ACE inhibitors with the desired reduction in blood pressure. It works in the level of the lungs because it is, again, where ACE is made. The side effects would be coughing, orthostatic hypotension, angioedema, and hyperkalemia. When it comes to this type of antihypertensive, remember the ACE acronym. So, first A means avoid pregnancy. Second A would be angioedema, puff up tongue. C, cough. And then E, elevated potassium. So, you should avoid salt substitute. The next type of antihypertensive medication is what you call direct renin inhibitors. So example would be aliskiren. It binds with renin, which reduces ANG1, angiotensin 2, and aldosterone. It's commonly given with HETZ or hydrochlorothiazide, and the side effects would be hypotension, hyperkalemia, edema, and gout. It also might cause pharyngitis, diarrhea, and heartburn. We also have angiotensin 2 receptor blockers. So the drug in focus for this would be the losartan potassium and then the valsartan. It is usually the second choice for hypertension control because it blocks the activity of angiotensin 2 and from angiotensin 1 and results to vasodilation. Does not cause coughing like the Prils medication. If you're pregnant, you should avoid taking this and avoid eating foods that are high in potassium and salt substitute. Side effects would be hyperkalemia, peak T waves in your 12 lead ECG, muscle cramping and spasms, and again, remember to monitor the EKG with these new medications. The next type of medication will be the direct acting arteriolar vasodilators. The drugs example would be hydralazine, minoxidil, nitroprusside. So these drugs are used for emergency hypertension, eclampsia, and pre-eclampsia. It is because the rapid effects of hydralazine, the body compensates by increasing the heart rate due to hypotension effects. These drugs are also referred to as a reflex tachycardia, and it's the reason why give beta blockers to slow the heart rate down. And side effects would be palpitations, edema, dizziness, GI bleeding, and neurologic symptoms. And finally, we have the last time, which is the calcium channel blockers. Examples of medications that belong to this type would be verapamil, diltiazem, and amlodipine. Again, this is used for hypertension and also for heart failure. Side effects would be flushing, headache, edema, and bradycardia, and also a possible AV block. Because what it does is it inhibits influx of calcium in the heart, muscle cell membranes, resulting in decreased myocardial contractility. And then as a nurse, you have to monitor orthostatic hypotension, changes in the EKG, paresthesia, and angioedema.